I'm Kristen Valdes, founder and CEO of b.well Connected Health, and we are here with Medicarians Live. Joining me is Choi. I would love for you to introduce yourself and tell us everybody who you are.
Great. Well, my name is Choi. I'm the head of digital health at Samsung Electronics America. I'm also a practicing clinician. It's been almost 20 years actually practicing. And so with those lenses that I've been thinking a lot about some of these areas.
Well, Samsung has had a number of major announcements over the last couple of years in health. It seems like Samsung's going all in its healthcare business, which is exciting to see. But specifically, talk a little bit about why Samsung is poised to participate and have active benefit in healthcare, right? I mean, obviously, big tech company, electronics company. What is your role in healthcare and how do you see it?
Yeah. Well, personally for me, healthcare is a personal mission, as is not surprising as a clinician, to really improve people's lives. And I think at Samsung, our shared vision is about building a healthier future for everyone. Recognizing how fragmented the healthcare system is, I think we feel like the opportunities around connected care centered around the home through connecting services, connecting people, and connecting devices. Now, we feel like we have a very strong starting point for that, given the broad portfolio that we have. Think about the TV in your home, think about the refrigerator, the stove, your smartphone, your smartwatch, rings, and etc., as well as IoT, and the fact that we have tremendous penetration. Around 70% of American homes have brought Samsung into their homes. It's a fantastic starting point to start thinking about now, how do we connect those things to improve health? So as a physician, as a leader on the healthcare team, that's what I'm thinking about constantly. Those touch points that we have in the home, how do we tie those things together? How do we understand user needs, understand their goals, tie them into care when they might need it, help them care for their aging parents or their children? And I think a lot of that starts with the data. And I think that that is a kind of a fundamental piece that we've been thinking a lot about as a starting point. And so through our partnership together, we've been made huge strides in this area. We at Samsung on our own can bring in a lot of lifestyle data, through our wearable sleep, with steps and et cetera. But through our partnership, now starting to bring in clinical data, health record data, the data that sometimes is really hard to get to for your everyday person or patient. And so that now allows us to start to dream really about now we bring these things together, as well as medication data and et cetera, to enable services, right? To start to defragment many of the challenges that I think routine people face when trying to navigate the healthcare system and address their health needs.
I mean, 70% of Americans having a Samsung device. When we think about seniors, 90% of them have a smartphone, right? And with where we are in healthcare, the need to move more and more care into the home is becoming incredibly important from a scaling perspective. And when you marry that with the fact that the average consumer goes to the doctor only 1.4 times a year, maybe it's higher in the senior population and certainly those with chronic illness, but on average, it's still health happens the 90% of the time, between the doctor's appointments. It seems like Samsung is pretty poised to connect the dots and also think about helping to recommend to people when they might need care, because as we know, there's a lot of folks that wait way too long to get care, even when the signs and the symptoms start to emerge. So talk a little bit about what are the kinds of conditions that you're excited about, and sensors and wearables in the home where you think you can help solve for some of that.
I think you made some really important points. We know that 77% of aging adults want to age at home. Not surprising. I think that we all kind of feel that way. They're
I
concerned.
know I do.
Yeah, hands raised, right? On top of that, they're concerned about security. They're concerned about safety. They're concerned about progression of their health needs. And we kind of know that there will be a trajectory of potential decline. We can't forget there are the caregivers as well. About 20% of American adults are caregivers. For those who don't live in the same home, on average, they live 280 to 300 miles away, which is just incredibly stressful, right? Trying to figure out how are we going to meet mom and dad's health needs. It's going to be in the home, just like you said. And so we're starting to think about, the go-to topics like falls, for example. But I'd like for us to move beyond just detecting falls, which we can already do on a wearable, but start to think a little bit about how do we prevent them, or in fact, be proactive about that. We can analyze gait, track that gait, the changes in that gait over time, start to give us indications of maybe mom and dad needs to get on a program to understand how to exercise differently, to improve balance, agility, range of motion, et cetera, and stability, so they can reduce the risk of falls. So I don't want the first fall to indicate that there's a problem, we want to get ahead of that and putting in the right things in the home such that it protects them. And that we can kind of go on from there. And we can think through all the different ways that not only just health specifically, but cognition, mental health, financial security, safety, all those things really tie together. Because if you think about that, one of the most catastrophic scenarios where if someone loses a spouse, right? They're going to sleep poorly. There's going to be cognitive decline. There's going to be social isolation. There's going to be poor sleep patterns. All those things together, we need to think about those things holistically. Unfortunately, I think in Silicon Valley and in digital health, we're really good at taking these huge problems and distilling it down to these little narrow things.
Yeah.
Address diabetes, just address medication adherence. But we really need to think more holistically. And still goes back to that data. It's like having that comprehensive data view to start to build those right insights. And so we can build towards then really addressing real problems for care recipients as well as caregivers.
That's amazing. A lot of what you guys talked about and your devices and your ability to see into the home and the conditions that you've talked about, you approached b.well and said, hey, we really want to add additional data points in for our consumers. We want to give them the ability to collect their entire medical history and carry it with them on their device and share it downstream with whomever they choose, including, to your point, you talked about caregivers. I'm a caregiver, not only to parents who are aging in place, but also to a rare disease child who has 26 clinical patient portals. None of them are accurate. None of them talk to each other. And her having her medical records on her phone is life-saving for her. So talk a little bit about the why. Why does the medical record add to the technology work that you guys are doing?
Actually, I think in some way, while I spend a lot of time entering things in the health record as a practicing doctor, I think when it talks about how that data flows and some of the challenges around that, you're the expert. So let me actually reflect that back to you and share a little bit about your point of view as relates to that importance of interoperability to really addressing real needs.
I think the thing that I'm most excited about, at least I was excited about, as you guys came forward, and what I actually am now more excited about was we worked really, really hard to open up interoperability for a country so that the average human could collect their medical records so they didn't have near life, altering episodes like my daughter did because systems couldn't talk to each other, right? And having a unified language. But the fact that Samsung went beyond what most technology companies do, which is just pull the information in and show it to the user, which if you're a consumer, it really doesn't mean much to you because medical data, as you know, as a physician, it was not meant for consumer consumption. So when you all said, I really want to surface insights, you have tons of insights on fall detection and changes in the home, but you actually wanted to go to evidence-based medicine,
Yeah.
which to me was life-changing because to 64 million Americans with natively installed phones and, more than 70% of Americans with a smart TV, you have real opportunity to reach to do things for caregivers that we as like busy moms don't have time to do, right? I don't know when my son is due for an updated tetanus booster, but I do know he needs one because he puts a fish through his ankle every summer,
Yeah.
right? So it's real important for me as I care for 7 different people. 86% of healthcare decisions in our country are made by women. But I do not have a single first screen mobile application that helps me manage my family's health in one place. And it's what I crave because I want to know when dad's not taking his meds on time. And I want to know when Zach needs a tetanus booster. And I want to know when Bailey's meds are up for prior auth renewal, which is a really scary thing for somebody with rare disease. So when I think about the opportunity to be able to say, it's time for you to have this preventative screening. And as we think about shifting to value-based care and getting upstream, the reach and the magnitude that you all have is kind of the first thing I was excited about. But when I learned about these sensor technologies and the things that you could do, I envision a world, and maybe this is where you're going, maybe it's not, you tell me, right? But I envision a world where dad's visiting, sitting on the couch, watching his favorite TV show, and he starts having a cardiac episode for the first time. It shows up on his watch. Samsung knows it. He just knows he feels a little funny, but he's not sure why. Maybe he didn't sleep well, or maybe it was the travel or the change. So he just misses it, which is common with my dad.
Yeah.
And so your ability to move beyond just the insight to say, it looks like based on your medical record, you don't have a cardiologist and you haven't seen your primary care in a period of time.
Yeah.
Can I help you with that? And the announcement that you all made with some of our partners like Walgreens and others to say, we're going to allow you through API technologies now to be able to surface an appointment. So when you say Zach's due for an updated tetanus booster, Walgreens can see him next Wednesday at 2:00.
Right.
Would you like me to book this appointment for you? You've actually created convenient care.
Right.
And that is the thing that I think I'm most excited about. Tell me how you're thinking about that.
No, again, you're talking about how the incredible fragmentation of our healthcare system it is. It is from a tech point of perspective, a terrible user experience. And as a physician, I'm sometimes struggle to try to navigate it, let alone I sometimes I feel like anyone who doesn't know someone who's in the healthcare system is definitely out of luck. I think that there is, I think what we're excited about is that our position is as consumer technology in people's hands, on their wrists, and in the home. There's people open their fridge, open and close their fridge 33 times a day. People check their phone over 100 times a day. There's a tremendous opportunity to engage people, whether it be helping them identify information they need, to notify them, to remind them to do X, Y, Z sort of thing, or to have a lot of information in one place for them to easily access. What we need to move from is once we have access to those data types, is to derive that personalization. It's the question that I ask myself and I ask my team every day is, so what? We can do this kind of cool thing, but so what? How does that going to really help things? And we need to quickly start to get to, so we can help you close gaps in care. Get that screening that is appropriate for you at your age, your family history, your risk factors, etc. To get to that level of precision, I think is something that's really exciting. We're at a time now where there is just an incredible amount of data. We can think about the data that we produce in the home. I mean, of all the technology that we're using, the routine things that we can learn and predict potentially, but also as an individual from genomics, electronic health records, proteomics, all this stuff, right? That is, I mean, while interesting, really meaningful only when you could connect those dots to say you should do XYZ thing differently. And I think we're going that direction. As we think about the role that AI plays, I think two of the strengths about AI is being able to analyze incredible amounts of data to try to figure out how do we connect those dots, but also around the engagement. As a clinician, as a primary care clinician, physician, in the engagement part is one part, the area that we struggle with. And I think with consumer technology in particular, it opens up an opportunity to drive that engagement in ways that medical devices and other technologies in the past have not been able to do before.
But what I hear is personalized, convenient, and knowledgeable care at scale, real time and all the time.
Yeah.
Thanks so much for being on Medicarians Live, Ricky. It was so amazing to have you. And thanks for everything that you guys are doing. And we're really excited to see this future that you're bringing to fruition, and can't wait to see what you can accomplish.
Well, I
Thanks
look
for
forward
being
to building this together.